Welcome to Learning Unit number 7. This is a shortened unit, and then we complete with our final course reflection. But please make note of the dates, and this is a unit in workplace well-being. So for this learning unit, you're watching the video. Let's just review the topic. So we're going to identify a framework for workplace well-being and mental health. We're going to ready ourselves to use a framework for action, specifically when we are in Nursing 573. We can't possibly do everything in 1 minute, can we? So we're going to address these factors. And how do we address the factors of these frameworks with the professional nurses, staff, and students that we lead and educate? So another way of saying this is based on our previous learning unit. How do we apply principles of high reliability and resilience at the organizational or systems level? Most simply, we can ask the question, how do we get from where we are now to where we need to be? So by the end of this learning module, you're going to be able to recognize 2 system level frameworks that our organizations use or could use in improving joy in work and enhancing mental health and well-being. So let's look at what we will be doing as far as activities. So first of all, this is a week to catch up on your readings. So please complete any chapters that you may have missed. But remember, chapters 15 and 16 were not assigned, so I don't expect you to go back to those unless you want to. So then as you're doing 2 of your practices, doing your 3 good things for the last time and your relational gratitude practice, take a moment to listen to wait lists. And you can read about what neuroscience says about listening to this recording about reducing anxiety. So at the end of the semester, I always think it's a good thing to try to decrease our anxiety about completing the work for a course. So I listened to this as I was revising the learning assignments for this week. Then we're going to be looking at the Surgeon General's framework, and you can click on this web link. And this is a framework for workplace mental health and well-being. This is not specific for healthcare. It's talking about workplaces overall, but you can note some of the statistics of U.S. workers. And then you can begin to look at the framework. And I really do like this framework. So you can explore it by when you look at mattering at work. You can see dignity and meaning, but you could click on underneath here too and get a little more information. So it's not complex, but I think it is very beneficial. So then, of course, we're going to go back and look at the IHI framework for improving joy in work. And this is specifically pages 16 to 21. And if you have printed out the full framework, we're going to look at it a little bit in detail as we apply some of the principles of this framework in 573. So those are the pages that you're going to be reviewing. Then the 3 good things, of course, the relational gratitude, and then the discussion board. This is no reply required this week, and I'm asking you to compare and contrast the 2 different frameworks. And then note, which framework do you think is going to be most helpful to you in your role of leader, educator, and why? And finally, when you're done with that, you're going to see that your final course reflection is opening. I will have it open at the same time, so that's May 3rd. I will have that open along with your learning unit, and there will be a short video to explain what you're going to be doing for your final course reflection. But this is the last new content. There are some assignments for this learning unit, and then you complete the course with your final course reflection. Have a great week.